Assalamu alaikum everyone. I hope all of you are doing well. In this video, I am going to talk about the lower extremity of the humerus. In the previous video, I have already talked on the upper extremity of the humerus. So in this video, I am going to discuss the lower extremity of the humerus, and I will discuss the shaft later in another video. So the lower extremity of the humerus is also called the distal humerus. If you see the lower extremity, it is played from before backward. You can see from anterior and posterior, it is played from before backward. And the lower extremity is broader than the shaft. You can see over here, it is broader than the shaft. You can see it is broader than the shaft of the humerus. So if you see the lower extremity, there are articular surfaces, it have borders, it have fossa, and have epicondyle. So you can see over here I have two articular surfaces. One is this and then another is this. This lateral articular surface is rounded, you can see over here, and it is smaller than the medial articular surface. So this lateral articular surface is called a capitulum. It is called a capitulum, and you can see it articulated here with the cup shaped head of the radius. You can see this is the radius and this is the capitulum, and a joint is formed here. You can see over here, which is formed in between the capitulum and the head of the radius. You can see the medial articular surface. It is pole shaped and it is larger than the lateral articular surface. And here it articulates with the ulna bone, and it forms a joint here at the elbow region. Now if you see just on the front of these surfaces, there are small two depression. One is here, the other is here. This lateral depression is called the radial fossa, and this medial depression is called a coronoid fossa. And when we flex the forearm at the elbow joint, the interior border of the head of the radius then become fit in this depression. It become fit in this depression on full flexion. And if you see the medial depression is called a coronoid fossa, and when the forearm is flexed at the elbow joint, the coronoid fossa, which you can see over here, is fit here on full flexion of the forearm at the elbow joint. Now if you see the back of the distal humerus, there is a large triangular depression, you can see over here. This large triangular depression is called olecranon fossa. When the forearm is fully extended, the olecranon process is fit here. During fully extension of the forearm, olecranon process then fit here in this fossa. Now if you see here, the articular surfaces are little bit lower than the epicondyles of the distal humerus. Medial articular surface is more lower than the lateral articular surface. Two fossa are separated from each other by this ridge of bone. Now just lateral to the articular surfaces, there are two epicondyles. You can see over here, this is one epicondyle and this is another epicondyle. This is called a lateral epicondyle and this is called a medial epicondyle. And you can see the medial epicondyle is little bit larger than the lateral epicondyle. Now the lateral epicondyle, if you see from the lateral, the crest of the bone, which is called the lateral supracondylar crest, and there is a crest is going from the medial epicondyle upward. This is called a medial supracondylar crest. Now this lateral supracondylar crest from the sharp lateral border of the distal humerus, while the medial supracondylar crest from the sharp medial border of the distal humerus. So this was all about on the distal humerus. For more video, subscribe, like and share. So thanks for watching the video.